India is in the middle of a corona pandemic, and the country's handling of the pandemic has been nothing less than remarkable. But still, a lot more needs to be done. So should the health sector expect big support from the upcoming budget 2022? And will there be SOPs for the healthcare workers? Also, what about the overall infrastructure requirements of India? And will it be given any extra support during the upcoming budget? To discuss all that, we are joined by Shailaja Chandra, former Secretary to the Government of India and former Chief Secretary of Delhi. Mr. Pradeep Multani, President, PhD Chambers of Commerce and Industry and Chairman Emeritus of Multani Pharmaceuticals Limited. And Mr. Sandeep Gulati, Managing Director of Aegis India. Welcome, all of you. Ms. Chandra, I'm going to begin with you because you being a policy maker have in the past been able to look at this sector very closely, both administratively as well as specifically. How do you see India's performance so far? From 2019, the kind of crisis that we faced, certainly those don't exist, but yet a lot more needs to be done.
Yes, certainly. I mean, I think every country in the world was taken unawares, and India was able to measure up beyond the expectations of the whole world and managed very well despite many things which could have been done better. But this is not the time to go into that. I would say that India was able to do two things remarkably well, which very few countries were able to. One was that at the subnational level, the state level, every state, some slowly, some very fast, were able to pan out using the district system, which only India is the only country in the world which has that system, district down to the subdivisions or talukas, down to the village level, using their entire machinery. And I must say the district magistrates and the chief medical and health officers together were able to literally enter the houses of people and oversee isolation, quarantining, and that kind of thing very, very early as March 2020, because I had done some work with 4 or 5 districts. Bilaspur stood out, so did Kasargod, and that was something remarkable. No country in the world, and certainly not on the scale that India does it, was able to do it. That was remarkable was that the messaging from the center to the states, particularly in 2020, was very rapid. It was 24/7, and I must say that the health secretaries of the states whom I interacted with, I did it purely out of interest. I had no other, I was not writing or doing anything on television about it, but I was interested, and I did find they were all very, very giving praise for the support that they received in terms of technical advice, hand-holding. And I think that the back-end work, which was, the creation of all the PPEs, the masks, we had nothing, remember, and we really became net exporters at the end of it. So I think on these 3 counts, India did exceedingly well, and we have no reason to feel that we are second to anybody. For the scale of the country, we've done very well. But having said that, I would also say that I think the middle class, that is the unorganized middle class, was caught napping because our country does not have anything like health insurance. And they were completely taken aback when they saw the bills they had to pay. And that is when the realization came that insurance is necessary for the unorganized middle class. And I would say that that's one area of great concern. The second is that we do not have anything called public health cadre. That is something that in the 2017 health policy had been emphasized. It was for the states, and I do hope that the budget would make a mention that they would have a central scheme or maybe some incentivization or set up some sort of a service which is a public health cadre, which is completely different from clinical and medical health care, which is all the the time, even in COVID, has been dominating all the discourse, which I think was something that should have been avoided. The National Centers for Disease Control is the agency under the Ministry of Health. We didn't hear about them at all. They were trained by CDC during the 2010 H1N1. I think this is time to rebuild that institution, because public health is very different from hospital care. Public health is what will prevent the onset of epidemics and outbreaks. So I would say that that is an area which does require great policy level support and financial support.
Thank you, Ms. Chandra. So I think we managed the emergency very well. Now we need to look at business as usual. Mr. Multani, how would you look at this entire thing? As a person who was overseeing in the pharmaceutical sector, you must have seen this entire crisis very closely. You would have worked with policymakers, you would have worked with hospitals, healthcare, doctors. What has been your experience regarding this, and what needs to be done further?
You see, basically, I think our Indian government really handled this whole COVID pandemic in an outstanding manner. Looking at a population of 135 crores, the number of cases which we had and the number of deaths we had, I think they were the least in the world. If we are looking at, the Western world, the so-called advanced countries as a role model, our healthcare system will be able to achieve that healthcare system only maybe in 20, 25 years. But we have seen how miserably they have failed. The number of cases they had, the number of deaths they had, I think those countries did not come up to the mark. They did not serve the population. Again, I said our government did a great job. But yet, I would definitely say there were a lot of difficulties which were faced by a population. And definitely looking at this pandemic which took place, it is very, very essential that just like that for the normal Indian citizens, just like we have for workers and ESI facilities and all, I think for each and every Indian, we need to have some sort of a health policy where any Indian can go to some hospital and get treatment, hospital or a clinic and get treatment done. And again, we should also be looking at preventive healthcare will be the main thing which one should be looking at. We have seen if we work on building immunity and, I come from the Ayush sector, I firmly believe the first line of defense and treatment should be the Ayush system. Why, instead of, burning why let the fire come up in the first place? If we insist on yoga, wellness and preventive healthcare, I think things will be much better.
Thank you. Thank you, Mr. Multani. Mr. Gulati, I'm going to come to you to talk about infrastructure in general. But before you talk about infrastructure in general, could you just tell us what is the state of India's health infrastructure and then take off from there?
Thanks. So, on health infrastructure, and I think both the esteemed panelists have already said that, we have done very well in terms of handling COVID. But in terms of our infrastructure, obviously, I think we all need to agree that there is definitely much more that needs to be done on infrastructure. We are in the right direction. I think that directionally, overall, not only healthcare, overall infrastructure, the direction from the government seems to be absolutely on the right path. In terms of healthcare, developing medical facilities, developing medical universities, and then going into tier 2, tier 3 cities and, putting the infrastructure in place. I think all of that is definitely well-intentioned. And the pandemic has only kind of given the speed that it needed, to go into that side. And but I would like to take it more broadly on an infrastructure side. Again on infrastructure, I would say that directionally extremely good, very encouraging. All the right large announcements being done by government, whether it is Gati Shakti that you have, where you have the holistic development across domains, whether you talk of asset monetization or asset cycling, recycling, as you call it, or making the DFI, the large national bank for infrastructure. All of these point towards the government's intent to give infrastructure the push that it requires. But then comes the most important question: how we are going to execute all these large announcements that have come in place. I would still reserve my judgment on execution and implementation of these large projects. It is not too much time which has passed since these announcements have come. And the initial steps taken by government, even on implementation, seem to be quite good. On asset monetization, you have seen case of Air India. I think it is one of the good ones that we have done for a long time in terms of demonetization. The monetization, the assets that we have. But I think 2 or 3 large points come into play where we need some more clarity. For example, on Gati Shakti, you talk of a number of 5 lakh crore to be invested across sectors. What is the financing scheme of it? Maybe we'll hear it in the budget, upcoming budget. But I think financing mechanism for these large projects need to be announced. InvIT, again, a very, very important and a very good step being taken. NHAI, the recent InvIT that they went into, the infrastructure investment trust that they have. But again, we still need to understand the technical, aspects of it on revenue mechanism, for example. So also maybe implementation, only the time will tell. In summary, directional, extremely good implementation. Going by past may need some time for us to understand its full impact.
Thank you. Thank you, Mr. Gulati. I think the government has been in a sustained way, pushing for infrastructure over the past few years, and I see this budget is going to be no different. Let me come back to Ms. Chandra. Ms. Chandra, on the soft side, we have discussed that India has done very well and we have done remarkably in terms of managing this crisis. My question now is the back-end health infrastructure, let us say medical colleges, hospitals, the setting up of these things. Why is it so difficult to set up a medical college? Why are there so many requirements, so many permissions? Shouldn't this be the time when we look at healthcare sector in general and health infrastructure in particular as a strategic sector and push for it as much as we can, given that there is this opportunity, apart from the fact that our share healthcare spending is not up to mark?
Well, when you talk of health and infrastructure, I think one should be very clear that the beds in the hospital beds throughout the country, more than 2/3 are in the private sector. And when you talk of hospitals, the chains, all your Apollos and Max and Fortis and Narayan Hridayalaya and all, they account for just 5% of those beds. So there is a huge private sector which exists, which is almost 65% of all the beds that you own. What is in the public sector is basically, if you really put the beds together, it boils down to the hospitals run by the government, which are, of course, huge when you think of the size of some of these hospitals. All India Institute, Safdarjung Hospital, the state hospitals, they're huge. But comparatively, the bed strength is much, much lower. Now, that bed strength has to be improved upon. And when you talk of medical colleges, I think the policy decision to try and convert all the district hospitals into medical colleges is one of the most, I would say, futuristic and something which should have been done maybe 20 years ago. Because a medical college, when you ask me why does it take so long, it's a question of, do you have all the infrastructure, which is not bricks and mortar? It starts even with having dead bodies for doing the anatomy work. Do you have everything that goes into making it worthwhile for a patient to enter the hospital? When medical college permissions are not given, it is usually because there are no patients. A college needs patience to teach the students. So if you don't have the kind of teaching faculty which is able to give the kind of teaching that the students need, patients will not go there. They also know what is good for them. So when you are able to convert a district hospital, it is a win-win situation because the patients are already there. But you do need better quality of supervision, better monitoring, and I'm sure that will come. So in one sense, the medical college at the district, the district hospitals being converted will be, if it's taken up by the state governments in all earnestness and they're given support, financial as well as technical, I'm sure that is the way that would improve things phenomenally. But having said that, let's come back to the 65%, which is the private sector. There, I think that we have not really paid enough attention. Every time there is some discussion, you're looking at the chains, you're looking at the hospital chains. Now, when foreign direct investment came, and it came many years ago, 20, 25 years ago, it was approved as a policy and has been consistently supported by every government, allow foreign direct investment into the health sector. Once that comes, one must understand that people are in it for business. It's not a bad word. Now, if they're in it for business, they are going to look for profits and they're going to look for maximizing of the profits. There's nothing wrong with that. That is why government has a very big role in regulating that private health sector, which is basically the sector which is charging a lot of money, giving a lot of service, no doubt. But the telecom sector has a regulator. The power sector has a regulator. How come the health, which is totally, it impacts so much on the patients, on the consumer. It doesn't have a regulator. It is necessary because the consumer courts hardly look at medical negligence, medical malpractice as an issue. They're looking at so many things, starting from toasters and all kinds of other small household gadgets, right up to something as important as somebody having been operated wrongly or a paramedic having completely finished a case, because hospitals they spend a lot of money on protecting themselves before the court. But that can take years. So just to round up what I'm trying to say, I would be very happy if the budget announces the setting up of a medical tribunal or a medical, you might say, regulator. And it is not to interfere and find fault. It really has to work in a very professional way. And it is working exceedingly well in the power sector. It's working extremely well in the telecom sector. What is the problem in having the same sort of arrangement? SEBI and the Corporate Affairs Ministry is not the place to do it. So I would say that is something I would welcome. And the consumers would welcome it hugely. So coming back now, if only 5% of the beds are in the health sector, that is the, you might say, the hospital sector, the chains. The rest, which is such a large number of beds, are all in the unorganized, non-chain kind of single hospitals and nursing homes. I think some kind of supervision is necessary over there. And for that, there used to be a Clinical Establishments Act. Many states have been dilly-dallying. If the center were to push for that and incentivize their taking it up, that act is already there in Parliament, passed by Parliament, but it's a model act. Every state has to really, absorb it according to their own conditions. It's more than possible, but the Indian Medical Association has always resisted it. I really feel the budget is the time to say that this will be done, because consumers going to all these standalone hospitals and nursing homes do need to be protected, and we don't have to overreach and make it difficult for people or to drive prices up, but there is a way of doing it which is necessary. So that is really my take on this.
Thank you, Ms. Chandra. Those are very deep insights, and if nothing, at least the budget should start the discussion and debate around this. If it's a concurrent subject where the union as well as the state governments have to work hand in hand. Mr. Multani, how would you take these suggestions as a supplier to the healthcare system, to hospitals, to dispensaries, to nursing homes? Do you see any, do you resonate with these ideas? of first medical colleges being all district hospitals becoming medical colleges, and a medical regulator being put in place?
Since I am a firm believer in the competence of the Indian healthcare sector, I think we have got fantastic potential. First and foremost, of course, the thing comes up is that unfortunately the potential which we can get from the health sector, we are not able to achieve it because of so many restrictions which are imposed on the, various government departments are there. That list is phenomenal. I mean, it's impossible to set up hospitals. The sort of departments you have to deal with is a big problem. I personally look at that we can, just like we are the pharmacy of the world, we can be the hospital of the world. So let there be an ease of doing business immensely in this country. We can be the hospital for full Africa, South Asia, Middle East, and it can be a very, very big source of revenue generation for our country. Medical tourism can be a big money generator. And apart from that, when we are talking about, I do respect what Madam Shailja Chandra ji said about a regulator. I would just say that the problem here is that our judicial system is weak, in the sense that we need to double the number of courts we have and fill up all the vacancies which are there for judges and judicial officers. I think we should move in that direction, do that so that if people go to consumer courts, it doesn't take 5 years, 10 years. Because I personally feel that the number of departments which we have to face, let's reduce them. Regulator is good, but again, reduce at least 10 different departments which the hospitals and the industry has to face, and then get more department in. I would also like to just mention about one thing, that today, I again would like to mention that the Ayush sector, for example, we have seen that during this pandemic, the Ayush sector did phenomenally well, because all the Ayush industries, they had bumper sales. And fortunately, our Honorable Prime Minister also in his advisory mentioned that take immunity boosters like Giloy and Ashwagandha, Chyawanprash and things like that. Now, this again, for our own population and for the world at large, just like we have the traditional Chinese medicine, which is all over the world, we can have our allopathic system, allopathic doctors, as well as our Ayush system all over the world. Yoga anyway is all over the world. 21st June is the International Day of Yoga. Similarly, we can take our Ayush system all across the world.
Thank you, Mr. Multani. Mr. Gulati, I'm going to, we've talked about regulators, we've talked about regulators are good, but let there not be over-regulation and so on. From your experience in other infrastructure sectors where the regulators are there, for instance, in roads or in airports or in ports, what lessons can we draw from there that have enabled the rise of our roads, airports and ports and transplant them onto the healthcare sector?
I think it's a very good question. And yes, over the last few years, we have seen a lot of infrastructure development. And obviously, it is led mainly by road, then followed by rail, and then urban development, etc. And I think the regulations for me, lesser the regulations, better it is. I wouldn't, obviously we can't wish away all the regulations, but I think consistency of regulations, consistency of rules, simplification of rules. These are few things which I've seen improved over the last few years really hugely. For example, procurement rules, procurement guidelines for buying on infrastructure. I mean, the rules have been modified and improved quite a lot. For example, now you have, a technical weightage in a procurement. You can't be L1 in a lot of things. Obviously, it's more central projects than state projects. But that's one big change that we have seen. Enforcement of contracts, again, extremely important, which was weak earlier, which is an area where we have improved. So I think there are many learnings that we can take from all these large, regulators or policies that we had in infrastructure, which can be replicated to healthcare. But again, having said that, I won't say that everything is extremely good and clean and all that. There are areas to improve. I'm looking forward to this budget actually with a lot of interest, because I believe that this is the time when India really needs to push hard on infrastructure, including health infrastructure. We need to be slightly more bold. If you see the stimulus packages being announced by European countries and by large developed countries, obviously we can't compare with them, but then they have been quite bold. I know we have fiscal challenges. Our fiscal deficit is north of 9%. Your inflation worries are already there. But I think we need to put these risks aside and at least for 2-3 years really push hard on infrastructure. We need to be bold on this, and then some of the basic steps I'm sure would help push the infrastructure much more. Tax slopes, we are anticipating some tax slopes in certain areas. Infrastructure, you believe, two large raw materials, cement and steel. Cement, we are on the highest GST bucket of 28%. Import duty on steel has not been reduced. You see the prices of steel have doubled over the last 1 year. I think these are some of the areas wherein you need to take into account what is the ground reality. And with that, we are in for some really exciting times going ahead.
Thank you, Mr. Gulati. And I also feel that perhaps the risk capital is the treasuries of the large infrastructure companies are already full, and I think many of them are planning major reinvestment. So all that is required, in my opinion, is to create an atmosphere where entrepreneurs can come, invest and grow, apart from the financing part that you mentioned. Thank you, Ms. Chandra. Your ideas on the cadre and the regulator are extremely useful, and I certainly feel, maybe not in this budget, but certainly going forward, these are ideas that need to be pushed forward. Mr. Multani, you agreed with that. The regulation is good, but not over-regulation. All of us agree with that. Perhaps what we are talking about is accountability of a regulator rather than just meaningless clauses and compliance requirements and filing requirements. Thank you very much for being here. It's been a pleasure.
Okay, thank you.
Thank you very much.